Hi there, everyone. I think we'll get started now. Hello, and welcome to today's dialogue on development research, steering a behavioral transition from open defecation to toilet usage for sustainability. Thanks for joining us today. My name is Carly Veas, and I am a project manager in the Development Policy and Finance team here at the Stockholm Environment Institute, also known as SEI. I will be moderating today's session, and today we will be focusing on water and sanitation and hygiene issues, also known as WASH, but more specifically, we'll be focusing on the issue of open defecation, known as OD. The issue of open defecation is a widespread challenge. In 13 countries, 1 out of 4 people are practicing open defecation. That's 419 million approximately people practicing OD, and it brings with it both environmental and health problems. Today, we will be learning about the behavioral impact of social norms or the impact of social norms on behavior in relation to open defecation. And our keynote speaker today is Dr. Shyama Ramani, who is professorial fellow at the United Nations University and is an expert in game theory. Shyama has a PhD in economics from Cornell University and has been focusing on the issue of open defecation for many years now. In addition to her research, she also has founded a charity called Friend in Need India Trust and also the social enterprise called Site for Sustainability, which explore how to drive positive change through charitable and market-based solutions. So after Shama has shortly presented her work, we will be joined by Dr. Nicholas Ikwa, who is the founder and national coordinator of OpsWash. And we will soon invite the speakers to join the stage. I wanted to mention that after our speakers have talked, we will have a Q&A session, and we then invite you to pose your questions in the chat. And when I invite this, or when I start to welcome the questions into the conversation, I will also offer you to speak your question on your own, meaning I won't have to read it for you, but I can also invite you to pose your question by yourself if you would like. So you can be ready to put on your microphone if so. On another practical note, for those who are not familiar with Zoom, I wanted to mention that you can at any time change the settings so that you see the view differently. And you do that by going up on the black banner in Zoom. There's this little box to the right called View. Click on View, and there you can choose, for example, the gallery view when you see lots of participants at the same time, or you can choose to see the speaker view when you see the speaker and the presentation only. I'm going to briefly hand over to the main speaker, but I would first like to take the opportunity to tell you a little more about this seminar series, why we're here. The dialogues on development research is what we call them. And they are organized by the Swedish Development Research Network called SweDev and the Development Policy and Finance team, which I belong to here at SEI. And the aim of these dialogues is to spread findings of development research by creating a learning space where researchers can share their work in an informal setting and easily accessed setting as well. And just briefly, I'll tell you a little bit more about SweDev. So if Annika could change the slide to the SweDev slide, I'll tell you a little more. So as I mentioned, SweDev stands for Swedish Development Research Network. And there we go. Thank you. You can go exactly. Thank you. So SweDev is a member-based network, and it connects development research across Sweden in order to strengthen collaboration between the research community and also to increase interaction between development research and practitioners. So we often collaborate and work closely with practitioners as well. So what do we do within SweDev? Well, we do several things, but for example, we facilitate collaboration between development researchers and policymakers based in Sweden, as briefly mentioned. We also act as a hub where one can find the latest news and opportunities for development research collected in one place. And we organize seminars, conferences, and workshops where researchers and policymakers can interact and share knowledge. To tell you a little bit about SEI, where I work, we can just thank you, Annika. SEI is an international nonprofit research and policy organization. And here at SEI, we tackle environment and development challenges through scientific research, but also through public policy advice. We have offices in 5 continents, and we work both, well, locally, regionally, and globally. And briefly, just the development policy and finance team where I belong here at SEI headquarters. We're an interdisciplinary group of researchers, and we work to support more equitable and sustainable development through demand-driven and solution-oriented research. Now, with that introduction, I would like to hand over to Dr. Shyama. Thank you for being here today, and we really look forward to hearing about your work. So over to you, Shyama.
Thank you, Carly. Thanks to all members of the organization team. They've done a superb job in getting in touch and making sure everything is ready. Can you all hear me properly? Okay, so this paper, this presentation is on a paper that is work in progress. It's being written by me and along with 2 of my colleagues, one from the university, United Nations University. He's a software, he's an econometrician, and a volunteer in the NGO who happens to be a software engineer who finds this problem very interesting. And he was wondering how I'm going to develop a model. So this is another example of how my practitioner work is leading me to explore avenues I would have never dreamt of exploring otherwise, using approaches that I wouldn't have thought of otherwise. So this is a transdisciplinary work, and it's about how we can really make this sustainability transition happen. Now, Carly has told you a little bit about it. Let me just go into the details. So I'm going to first present the problem, and I'm going to introduce a framework called Theory of Reasoned Action. This is a framework that comes from socio-psychology. It's really been used by marketing experts to make people buy things that they don't really need. So I was wondering, what about using this also to make people do what we want them to do? Say use toilets. And it's a very, very powerful tool. I will tell you more about it. I'm combining this with very simple game theory. All my game theory is very simple. It's really modeling how we play games in life. Then we have the inferences, some simulation results. I'll tell you why we need simulations, and the conclusions for policy. So basically, you see, open defecation refers to going in fields, in streets, in street corners, in bushes, near lakes, near ponds. We have a lot of people in this world who have no access to private functioning toilets. They may be community toilets. They may not. Usually community toilets are not very clean in the global south. So we find that this problem of open defecation is still continuing. And they are principally in these countries which are marked in orange and red. Now, this is not something that the government is not taking notice of, because you see, simple thing as proper waste disposal of human excrement can really, really improve health outcomes. In fact, you know, even the simple cough, allergy and all is caused by the rotavirus, and it can be lowered if there is proper disposal. What is more horrible are the diarrheal diseases, especially in low income countries. Diarrheal diseases, which is totally preventable, is the leading cause of death. Now, as air pollution increases, respiratory diseases are also catching up. And of course, in places where there are conflicts, that's the main cause of death. But we have horrible diseases like cholera, diarrhea, and typhoid, which are debilitating. So the debilitating effects of open defecation is not something to be taken lightly. So by taking care of this problem, we can really improve human development in a major way. Therefore, you see, sanitation has been taken seriously, I would say, for the last 40 years, but really seriously from 2002, because under the Millennium Development Goals, this was not included. But by 2002, activists fought to get it included. And under the Millennium Development Goals, it was about universal sanitation coverage. And then Modi ji, in fact, the Indian Prime Minister, one of the good things he did was to put this as the centerpiece of his policy reform. Now, that's a very brave thing to do. And before the Sustainable Development Goals, he had already spelled out it's not about providing universal sanitation coverage alone. It is to bring about a phenomenal behavioral change. It's to make people use toilets, switch from open defecation to usage of toilets. And since then, it has been adopted as such in the Sustainable Development Goals. Rather than universal sanitation coverage, it is elimination of open defecation. Now, how have the governments been addressing this? See, they provided toilets first. They're usually of very poor quality, or they subsidize the toilets. And the standardized toilets, because they go by the checklist approach, is often pretty ugly as well. And more recently, there's a lot of marketing of toilets. We have had movies, ads, and they have been very, very effective in actually promoting toilet usage. But I don't like making a woman's value equivalent to that of a toilet. No toilet, no bride also is not the perfect discourse to push this. But they have not worked very well. Now, 4 types of challenges have been noted. First of all, population is increasing. And therefore, you see, you have to build more and more toilets. In the sub-Saharan region, especially, the population is growing much faster than the growth of toilets. And toilets, they take money to build, so it's not there. And then the other thing is the toilets are there, but they are not functioning. The third one is toilets are there, but they are not being used. And the fourth is toilets were used, but for some reason, they were abandoned. In fact, the global south is filled with millions of fossils of abandoned toilets, abandoned and stinky toilets. Now, in this model, in this work, wanted to focus on this problem. That is the behavioral problem of why are people not using toilets, or why have they stopped using toilets after using them. So this really has made it very clear that open defecation, which before was thought as being only due to necessity, it can be also due to choice. I'm not playing here the video that I have made of people saying why they prefer OD to usage of a toilet. I can let you guess, but many people say that they don't see the need for toilets. So now, in terms of policy, the most important policy milestone after the construction of toilets, subsidized toilets, etc. Now, this man, Kamal Kar, changed everything. He was a development consultant. And Kamal, what he said is that, look, you have to take into account the social norms. You have to do social marketing. You have to do social marketing in order to have behavioral change. And very interestingly, he brought out this book with Professor Chambers, a development economist at Sussex, who was very much taken up because this is part of the demand problem in development economics. Very often we assume that when needs are satisfied by the state or other sponsors, the problem will be solved. But it is not the case because of demand side problems. So they anyway wrote something called community-led total sanitation movement. And what is that saying? That is saying the following. Okay, this is saying that, look, we must do it by shaming. By the way, two economists who have since then won the Nobel Prize, Taylor, they created something called the nudge theory, and they had also promoted simple shaming or simple rewarding. And they had many beautiful models, so they got the Nobel Prize, but essentially these people were saying the same thing. Those people got the Nobel Prize, for example, they saved the public health authorities a lot of money by making separate spaces for those who smoked. They shamed those who smoked. And this had a greater impact on deaths through cigarette smoking than any other campaign in the US. So this then moved to other places. So what I want to say is it's that very interesting that practitioners came up with this solution, which is essentially nudge theory. So they wanted to make people ashamed, and they wanted to create a repugnance for open defecation, and they did it through doing defecation walks. They wanted to show all the problems. They wanted to say things like, hey, you're basically drinking water contaminated with fecal matter. Is that what you want to do? Don't you want better health? And then once the bandwagon movement started, the idea was to shame people. But this kind of shaming process has not worked well in all situations. But it was still the biggest policy break, and all international agencies adopted it, so that CLTS is applied even today. It is considered as a policy tool. They have a toolkit for how to do all this. But in some countries, it has not worked so well as in others. In some zones, it has not worked so well as in others. And the problem is that in some zones, the shaming becomes too zealous, and then minorities are hounded. And this happened in India also. It was very disgusting. And therefore, this is a danger with any form of shaming, as we know. It's so under this context, I was curious, you know, can we come up with any community level conditions or conditions about sanitation drives that we can use to say, hey, this place is going to become open defecation free. We call that ODF. This is then a sustainability transition from OD to becoming ODF. So, which are the key factors? And it has been noted that some communities, after becoming ODF, have returned to OD. And therefore, how can this slippage be minimized? Now, that is a question we started out with. And then a student of mine applied this theory. She only introduced me to the theory of reasoned action and planned behavior to study how in Italy, which is the home of fashion, fast fashion can be changed, behavior can be changed to responsible fashion. Now, what do these people say? These people said that all of us, when we do something, we are actually not doing because we only want to maximize payoffs. That's the economics route. The homo economicus, the economists say, is someone, usually they are modeled as he or she, who likes to maximize payoffs to self. Now, we do know, even as economists, that this is not true. Many people are altruistic, and many people go by gut instinct. So we call this limited rationality. But where does this limited rationality come from? We do not know. To this, they gave a lot of cultural features. You have features, you have many types of beliefs, and of these, three types are very important. One is behavior. If I do something, what is the gain for me? Normative. If I do something, what will others think of me? Because these people started from the notion, as sociologists do, that the unit of analysis in a society is not an individual, but a network, a social network. It could be the family, it could be peers, it could be colleagues. So, what will the others think of me if I do something? And then there are control beliefs, which is about what is going to shape my other beliefs. What is the history? What is the infrastructure? What is the physical geography? What are all the things in the system that shape beliefs? Now, this determines an intention. And then they had something which is very agent specific. It's your free will or your confidence, your courage, whatever. So both these determine final behavior. And then they wanted, their theory always came under fire because they could not explain under what circumstances there is a gap between intention and real behavior. But this theory has been used to ascertain intention and likely behavior in, especially I have found it in management science. I'm sure it is there in other places. So now what we have is that I think it can be used. They used it to show why marketing drives don't work. But we can use it to also explain policy failures. We do not have good theories of why policies fail. So I thought this is a very nice framework to explain why community-led uh, sanitation drives, total sanitation drives, may not be successful. Now for this, I turned to the village setting and created a model. This is a very simple model. So imagine a village where, it has a number of social norms. And that is especially the case with global south, but I think it is even the case very much with developed countries, especially among youth, because they seem to be so influenced by not the community or their families, but by peers. So it means that if you don't follow the norm, you get punished. And we are seeing this all the time everywhere, especially among youth, gangs. But you see, who knows who is doing what? So assume there's a behavior detection machine, which is kind of imperfect. So you might get caught, but that's a risk. But in the end, let's say at the end of each time period, people talk, people know. So they get to know the information. You see, if you don't have information at each round when you're taking an action, the modeling is very difficult. So I've taken a very simple setting where people chat and get to know what's happened. So then why not apply this to conditions like this? Consider villages which had social norm, where the social norm was open defecation. Then the government is providing toilets. Now what is going to happen? So what we have is this behavioral beliefs. It's what you think is going to be your reward from open defecation or from using toilets. And I can tell you, this may seem like a strange thing to you, but due to pressure in our office in the village, due to the pressure from the house owner, we have installed a Western toilet. And it is a great problem because kids who come, to be trained in little games. We just had a summer camps. They're too afraid to use the Western toilets. They're afraid they will get sucked into the hole and be flushed out. So they piss in the corner and the toilet stinks. So we have had to conduct workshops with the children to get over their fear of using this style of toilet. So do not assume anything. And then there is the question of the citizens watchdog. What are they going to do? If I use toilets when other people are doing OD, what are they going to think about me? And what's going to happen? Because we're taking a very simple system, I will put it. And then there is a belief about value of the toilet, things that you might have read from the internet because everybody has a smartphone now, or from neighbors, or from going to the cinema in the town. So all these determine your intention to use a toilet. This is what you want to do. And then your confidence is whether you can do what you want to do, whatever you want to do. So this is the idea. And this governance thing, this for me, I was struck. This is the same thing as what we teach in economics. See, we have often heard of the carrot and the stick. Well, the carrot and the stick doesn't work without the eye. So, we know that in all law and order, there are many criminals who get away, but sometimes they get caught, then they get sent to jail. So we have got the eye, which is a behavior detection mechanism. And then we have got the warm glow. The carrot is a warm glow from doing what the people with whom you identify with also do, being part of your group. And then you have the community response. Now, the community response here I put in the carrot and I have put in the stick, because those who like what you do, well, they're going to clap for you. Those who don't like what you do, they're going to beat you up, perhaps, or make things tough for you. So we have to take both, and we have to put this against the value. This toilet itself, how good it is, and also what you think about how good it is. These are your beliefs. These are the beliefs. So I'm not going to present the model, but the intuition behind the model. so that I can run you through the results. So what these simple things will happen is that you can easily get, I come back to this. I have to do one thing before I come back to this. Sorry. This is the decision tree of anybody. Hey, I got a toilet. Should I use it? Whatever you decide to do, suppose the guy wants to use it, but they could get beaten up because they're going against the social norm of open defecation. Then they do the calculations. Even if the calculations are good, they have to check if they have the courage to try, because they might get caught and get beaten up. So this is usually called, in any game theory, it's called the rationality constraint. Rationality means, are you doing what you want to do? You're following your wants. Okay, so you might want to be altruistic. That's another thing. Then you be altruistic. You do whatever you want. It must be, your actions must be coherent with what you think you want to get. But then the participatory constraint is, can you do it? Can you take the jump? So when you put these things together in a model, okay, you can easily get some sort of a minimum level of confidence that everybody needs to have in order to use a toilet in a village. And assume this confidence is distributed normally. That is, it is an inverse U-shaped. So that means that whatever the level is, the bravest will try it out first. And then depending on whether they get punished or not, their confidence will be updated. And this way, we will get the evolution. You see, we assume every day people decide, do I want to use a toilet or not? And then some people's behavior get revealed. And then whoever is the power group in the village, they mete out the punishments and the rewards. Then at the end of the day, you get to know who got what. And if you don't get punished and you want to use a toilet, your confidence goes up. And if you get punished, your confidence goes down. So this is a very simple model like this. And we have, I won't put you through this mess, but this is how it looks. Now, the intuition for confidence updating is very easy. See, if the social norm is OD and you get punished, then your confidence to use a toilet goes down. Whereas if enough people use toilets so that toilets usage becomes the social norm, then we say the tipping point has been crossed, because from OD social norm, you come to toilet usage as a social norm. Then if you use toilets, and if you OD and you don't get caught, then you say, hey, nobody's going to catch me. I can continue with my OD. The guys who like OD, they can continue that. But if they get caught, they will think twice about doing OD. And this is this is kind of your CLTS mechanism, you see. They want to punish anybody who is not using a toilet. Okay, so now what we see, the inferences, is that theoretically speaking, this is what policymakers want. You start from universal OD. There's a takeoff stage when people start adopting toilets. And then suppose 50% is the tipping point. You can take any tipping point. This is the most natural one. So then when you go from more than 50% of the population using toilets to less than 50%, you have crossed this tipping point of social norms. Now, toilet usage is the in thing. And maybe you can go on to becoming open defecation free with 0% of OD. Now, what we found is that all our features, the things that we had used in the game, they play a role. There is the community response, which is just a strength of the watchdogs, community watchdogs. There's a watch, there's a warm glow, and there's just a relief from defecation. We had to put this because uh, whatever happens, whether you use a toilet or not, this is and that plays very little role. But the others do, the efficiency of the detection mechanism, and how risk averse are these villagers. So these then are pitted against the sanitation drive variables, which is the quality of the toilet. Because as I said, they're not always of good quality. And you see how they satisfy these conditions. Now, we first did it assuming that nobody is risk averse, because then we can solve things by hand. Now, let me just put it in a simple way. What we found very interestingly is the drivers for the takeoff are the opposite. I mean, not all, but a few are the opposite of the drivers after the tipping point. See, everywhere the high quality of the toilet is very, very important. But in the takeoff stage, the stick should be wielded less, and you shouldn't monitor people too much if you want people to take off. But once it has become the social norm, you can beat up people as much as you want to go to ODF because it's effective. That's what this is saying. So, which means that we are having a very interesting result, that CLTS is good once toilet usage becomes the social norm and not before. So there is a time for CLTS. Now we wanted to know also, okay, suppose we use this intuition. Does it mean we will always reach ODF? Are there other cases where we don't even reach the tipping point, or whether there is slippage? And for this, you see, to get robust results, we had to do random draws. That is, just assume that different people have different confidence level, try it out, shuffle it around, and see what happens. And it's very interesting. We first got, so you see, what you see here is that some villages will take more time than others. On the x-axis, we have time. On the y-axis, we have toilet usage. Now, this is for a case where the stick is very heavy, but the toilet quality is very good, and the detection mechanism is 50-50. So you can have this. But you can also have where you quickly reach about 70%. I mean, you reach between 65% to 75% of the people using toilets, but never 100%. Never 100%. And that's because, post tipping of the social norm, you don't apply the stick or the monitoring method. You don't, and then you don't make it to ODF. And then, of course, if we decrease the perceived value of the toilet, then you have situations where you're never going to take off. See here, out of 100 people, about 7 people tried out toilets. And because the toilet quality was so low, they stopped and they never tried, and nobody else did. So you never get over the open defecation universal state. Now, what about slippage? What we find is that we are in a simulations crisis. Just by lowering the quality of the toilets, it's not going to work. So we think it's going to happen if people become laxist about driving the policymakers or the local police. They are not induced enough to drive to open defecation state, and the toilet quality comes down, all these will strengthen each other. So we need a set of complementary factors which bring about slippage. We didn't have the time to do those simulations, so I can't show you. But we already have a policy lesson for sanitation drive. It would be good, you see, to just do a culture check first. What's a village like? I don't know how this culture check should be done, but I think sipping tea in a couple of tea shops in the village, or just checking with women at water sources would be good enough to say which villages have very strong policing groups and which don't, and how mean they are, and how strong this sense of community is, the warm glow, and how terrible they are for deviation. Now, I must tell that at least in India, every developing country has its own. We have lived with the caste system. We have inherited this horrible thing called the caste. And this horrible thing is still very much active in rural villages, okay, with respect to inter-religious and inter-caste marriages. Every now and then we hear of murders. So you see, this kind of social norm is very, very horrible, and the punishment is horrible. So these are all very, very relevant for developing countries. So then also for developed countries, as in gangs and schools, which are not good, because I'm seeing it in France also. So then for sanitation drives, educate, do not preach, but educate. And here the CLTS book is very good, not the shaming part, but the other part. And then wield the stick after the tipping point, but don't wield it before, and wield it carefully, because as I've told, there are overzealous shamers. And most importantly, ensure that an agency is there to maintain toilets. And so this is my presentation. I hope I have not strayed too far off from the time. Okay, thank you so much.
Thank you so much, Shyama. I am sure that many feel as I do. I see someone applauding, several people applauding. So they feel like, as I do, that it was very interesting, fascinating to apply game theory to this in this way. So to kind of continue this discussion and maybe get a little deeper into some of the issues, I want to ask Dr. Nicholas Igwe to now join us. And yeah, I really look forward to listening to this in-depth discussion. I'm going to take a little of a backseat role, and I will hand over to you, Nicholas. Feel free to, start with some of your own reflections after having heard the presentation, and then lead on any questions you may have to Shyama. Thank you.
Thank you so much, Dr. Shyama. That was very, very impactful and very insightful. And I think it's not very easy. People will probably be surprised on your using mathematical simulation for ODF, which is great. Yes, I see a lot of issues around social norms, or just focusing on social norms. I see your presentation was also focusing on more of, I don't know whether it is based on Indian perspective or whether this model can actually be universal. But one thing for sure was that you did not bring out so much around the health, the environmental issues, and the economic issues that will actually prevent seepage or slippage. How do we, the sustainability aspect of ODF starts from making sure that we have quality CLTS. So what that means is that there are some people that they will actually go out in different villages or rural areas and let them understand that the consequences of their actions, or rather their inactions in terms of open defecation, can actually lead to certain level of health that will affect them. That they're actually ingesting people's feces or fecal sludge or whatever, Those kind of things that will trigger them, that will make them not to ever go back to the, to the practicing of open defecation. So one is letting them understand the health impact. Yes, of course, you've done very well in terms of bringing the issues around diarrhea and typhoid and so on and so forth. But going very deep to let them understand that they are actually eating, if you want me to use the word shit, people's shit, doing the shit calculation at the end of the day, for them to actually get involved in shit calculation, we go a long way in making sure that the CLTS approach is more sustainable and they don't go back to OD at the end of the day. That is one. The second aspect of it as well, which you also touched on, is on the environmental impact. The environmental impact that it will have on them as at the end of the day. That is, after the health, we talk about the environmental impact. Then again, one major area that I also see, I'm from Nigeria, and as you know, Nigeria is quite high when it comes to open defecation. But one thing we have brought in from the private sector point of view is to actually let the rural people or the communities to understand that there is an economic value attached to fecal sludge, to physics. They start seeing economic value that can actually help them either in agriculture and so on and so forth. They start feeling that they are wasting in entrepreneurs to be actually part of the washcom, what we call, to a particular, village. Can you all hear me?
Sometimes you went off. Sometimes you went off, but now I can hear you.
Okay, you can hear me now. Okay. So bringing in different stakeholders, from the village heads to the women in the village, to the wash committee, to also entrepreneurs to understand more that apart from, because we're talking about sustainability, I think you made a very strong point on making sure that people do not go back. Maybe one of the other factors in creating sustainability or making sure that people do not go back once they have taken off, they don't go back, is those fears. One is the social norm, but those fears of going back should actually be highlighted more. And again, making sure that the entrepreneurs in those rural areas also see value, and that is why the container-based, system, which unfortunately has not been discussed, it might not be, within the scope of this, discussion, where private sector are actually willing to contribute a little bit by giving free toilet to people that cannot afford the toilet facilities. Because you mentioned that quality toilet is actually a first trigger. So having quality toilet from the beginning, and if we give out container-based toilet facility where they will understand that monthly or bi-monthly, we can come and evacuate, and they can pay within a particular time, maybe within 2 years or 3 years. But our own interest is the fecal sludge. So I think the economic value should also be added. We have to now find ways of adding the economic value when we go out for the CLTS. Let's have some entrepreneurs to also be involved. Let's not focus on the health impact. Let's not focus only on the environmental impact. Let's also see economic driver that will be able to motivate them to know that there is an economic value of if they can actually stop open defecation, there is something that can be in there, for them. And of course, the village political will that will strengthen the wash committee, because what we normally do, like in Nigeria, is to bring wash committee for M&E, and that becomes the I that you are talking about, maybe the I, you're talking about. Now, the M&E team will actually be part of the wash committee, who goes out from time, to time, not just to use stick or to, punish them, but to also keep on, training them on the benefits and so on and so forth. I think that is my contribution. Now, the question that I will ask you before I can come up again is,
can I comment? Can I first comment on what you have said?
Oh, yeah,
before I forget?
Okay.
First, this model applies to all developing countries because there's a lot of slippage in Nigeria also. And thank you for putting the value. I'm just going to share the screen because I had made a typo in the presentation. which I had forgotten to correct, which is written properly in the paper. So, oh geez, I thought, stop it, 1 minute. I must pull it out, just 1 minute. I will take out the slide. It is, as you said, the value perception. The value perception. Now I can share the slide. I can share the screen. See, the high value perception. So when you say value perception, you are absolutely right, Dr. Nicholas. We have to, what usually works most is a monetary one. So that's what we use. So what I'm saying is that the CLTS people must first start by educating and tell them exactly as you said, what is the value of the toilet, not just for convenience, not just for health, but for economic reasons. So usually in my NGO, by the way, I make toilets which are climate resistant, ecological, etc. And therefore this has come from that in another paper I've shown also, when this value perception is high, because I had raised money for other NGOs who had built toilets that actually all broke down. But still the people are using those broken down toilets and trying to fix because they know its value. So what I'm saying is that some of the CLTS everywhere has been they have been also rather too zealous in the shaming, ringing bells or, singing before people who go to OD. That kind of thing has had some backlash. So the most important thing is value perception, and my model holds for all countries. This is not an Indian context. The photos are from my NGO, but the problem is the same, and you're very right. So it's not high quality toilet, it's high value perception. Because as with Max, we have worked on another paper. Everything is, you might think it is a good thing, a toilet, but they must think it is good. So unless you are able to have this mutual sharing about the value of a toilet, it's not going to be adopted. So I'm with you all the way. I just wanted to correct that typo. Sorry.
Sure. Yeah, that's great. Thanks so much. That's very great. And another aspect as well is the healthy people. Just still talking about the value. It's only healthy people that can produce healthy economy. Now, if they also understand that based on the health aspects and how the health aspect can also affect them as well in terms of the economy, the rural economy, and so on and so forth, it's also something that we need to also add in there as well. But I think in all, we need to look at the takeoff. I love your graphical representation in terms of how long, the time factor there in terms of how long it would take to take off. Now we now have to develop the factors that one needs for accelerating takeoff. And the factors and one of the factors that you mentioned is quality toilet. There might be other factors that might be added to the quality toilet in making sure that people can take off immediately. And that obviously could be part of what you just mentioned, the value, the economic value. If you add the economic value, if people understand that they can actually make money from their physics, and that this is being done in all parts of the world, maybe it will also help in acceleration. And again in sustaining that, you did very well with the M&E framework, which I've also mentioned. Is very key. The M&E is very key because people that have not been practicing using toilet for a long time, maybe for their 30 or 40 years of living, they have that social issue of practicing open defecation. Now, changing that mindset within a very short period of time needs a lot of inputs from the people, for policy issues. And it's not just about punishing them, because remember, their mindset is different from the people who are training them. The people who are training them already have very good understanding. So we need to bring in other factors to accelerate takeoff. And when they have taken off, we need to still bring in other factors to be able to sustain them and see that they are happy, that they will never have that slippage. Because it will be very bad that a lot of efforts, funds have been put in. Remember, people go from different places to go to different communities and talk to them about this. The joy, what they will gain at the end of the day, is seeing that they are happy. When they come back, they will be able to see that people are still using the toilet. The other factor as well is cost, the cost aspect of this toilet to the communities. Because remember, in the past, the government felt, which of course is not working out, the government felt that they can build toilets for the people, which is wrong. Now, if people do not have money for even the cheapest toilet, no, they are convinced that this is not a good practice, that the cost aspect comes in. That is what we do in Nigeria, they call adashi, where people put money together, maybe 10 people put money together, contributing no money, and it rotates like a revolving credit. And sometimes as well, we can also, like the private sector, because the private sector understands that they are looking for the fecal sludge in terms of getting the resourceful material from there, where they can come and pull out from time to time, take it to a particular place where they can generate methane gas or organic manure. They also support them a little bit. But at the end of the day, it is also wrong from my own perspective to make them feel that the toilet is free. They should also know that they have to also pay for the toilet over a period of time. I think that will be that from me. But a very nice presentation, and we are looking forward to an ODF award if it's possible. But of course, with your efforts and the efforts of others, the SEI is doing a great job. And this discussion should be maybe the first session. We must have this kind of discussion on ODF in particular and see how we can also add up as well. And of course, your mathematical simulation will not just go unnoticed. Maybe at the end of the day, we'll bring academia, people to also look at that and see where we can also add other things. I think it's something. Bringing that kind of research into open defecation is something that the United Nations should be aware of, that we are actually doing so much, bringing innovation, bringing research into this, and it's going a long way to make sure that we accelerate the process of ODF globally. Thank you.
I just want to say one thing. I wrote my last paper, not this one, was to vent my anger actually at having got cheated, because this revolving door, when I was a naive academic starting to help a village, all these NGOs came and they said revolving door, and what they used is they used the money I had gathered, my aunt, my sisters, all of us had gathered, to build 350 toilets a little bit, like putting the base, putting this, putting that. And then what they said is the revolving door would work, and it would work. And then what happened is they just took off. And the guy got actually many rewards for starting this because I was an academic. But I was left with 350 unbuilt toilets. And now I had to decide whether I'm going to stay and do something. So it took me a long time to win the trust of the people. I told them I was a fool, but I'm a good person because I raised money, but they cheated me. And so now you see, slowly we are building, but it has been a very, very traumatic experience. So we have all the agency problems in sanitation. So I find every problem of the world is in this. So I really ask everybody that is a very interesting problem to study because everything is there.
Absolutely. I think, and that is why that was why I put up that question. Is this universal? You get to some countries like, Nigeria, where the structure is different. The structure is different because we are applying the sanitation and water for all multi-stakeholders, collaborative or collaboration in terms of bringing all stakeholders, the community leaders, the women, the boys, the girls, the entrepreneurs, the private sector in different rural areas, sanitation business, model became something that people started practicing. People started seeing that, okay, they can supply this, or started even looking at cheap materials that can be used. People started recycling stuff that they can be used. So when it comes to that sanitation, business, people started doing things and started seeing that there's also something they can do. They can keep them busy as well. Remember, you get some areas, people have used bamboo trees or bamboo trees to do lots and lots of toilets at very, very cheap. In some countries, maybe it might be expensive in some countries, but in Nigeria, it's very, very cheap. And people started using even the bamboo tree to do something for the flooring, in terms of flooring as well. So people started becoming creative, and that can only happen when we all come together and address challenges. Those challenges in OD will always remain, but we need to have a resilient spirit in terms of making sure that as we are having those challenges like you encountered, we find out other ways of doing it to be better. It could be that the agents might not be trusted agents. I don't know whether you give money to agents to build, the facilities. It could be that there could be better approaches in terms of, okay, build to 20%, I will pay you a particular amount of, money. 30%, I will pay you a particular amount of money. It might also, help. It's very revolving. It's not something that everybody will say that they have a standard approach to. They will keep on adding more and more. But the approach that you have, delivered today is a wonderful approach. And if followed and with other additions, I think it will make a lot of, difference. Thank you.
Thank you so much, Nicholas, for your contribution. Shyama, is there anything more you would like to respond to before we open the floor to questions?
I was listening to Nicholas and also typing. The thing is, you see, somewhere somebody has to sponsor, especially for the destitute, okay? Because you see, in the village where I work, nobody wants to pay for their toilets. It's so difficult. So the problem is not.
Okay, the connection is a little bit shaky there with Shyama. She'll probably be right back.
I think
soon.
I can come in a little bit just to, before she comes in. I think what she was trying to say is there are many people that might not really afford or really be able to afford to build their own, toilets. So we're talking about sponsorship. And that sponsorship, what we are also doing in Nigeria and encouraging other countries to do is whereby even private sector, remember, for example, Coca-Cola of the world, Coca-Cola, whether people in the villages or the rural areas, they take Coke or Fanta, whatever. So we have, okay, she's back. So what we have done,
but go ahead.
But what we have done was to encourage Coca-Cola. Because remember, one thing is to have household toilets. But you also understand that we also have public toilet in the rural areas as well, like a market, places. Because remember, you can come home and of course you have your toilet in a facility. But what if you go to the market settings, like what we have in Nigeria, and there are no toilet facilities in the public areas? Yes, the government might say they will be able to provide. So the issue around CSR or philanthropic contribution, but not for rural areas, can also assist as well in creating those public, toilets. Then, of course, what we have also done was to approach the diaspora communities. Because remember, like in Nigeria, we have lots of Nigeria in different parts of the world. And when we now brought up the issue around the social norm, the health, the environmental, the economic, and so on and so forth, and to also support and sponsor, some of them started even sponsoring household toilets. The people that we know that the poverty level is high, but it comes with its own challenge as well. If you build a toilet for me, and the toilet is good quality toilet because it's been, somebody supported me from the US. If somebody else has another toilet, he will break the toilet down because he wants somebody to come and build the same type of, toilet. So it's a very dynamic, system, but it's something that there must be collaborative support, whether it's coming from the from different, private, sector or from even individuals, themselves. I saw the passion when Dr. Shyama did not want to talk about pride. If you want to marry somebody, the person must have toilet, the man must have toilet. If that, is not a bad approach as well. It's part of that support that we are talking about, and so on and so forth. Let me hand over to Dr. Shyama. She was trying to say something before we lost her for a while.
No, I said I need Nicholas's help. I'm desperate. I don't know how to attract CSR. I don't know how to attract Coca-Cola, you know. So Nicholas, please help me because I haven't, I'm not, those 350 toilets, out of that 250 are still junk. And
Yes.
so the thing is, it's, I salute Nicholas and all the private agencies, you know, but till now I haven't really found, at least in India, I haven't good quality toilets, uh, because there is such an emphasis on scale. There's an emphasis on target based projects, so that you see this education and valuing, it's all done in 2 days. Now in 2 days, it's difficult to assume that you have convinced people of the value. So it's a checklist approach. And what happened to me was, I was very happy, but over years, 2 3 years, the toilets just crumble. So the thing is, it's the will is very important, and good things are happening. I do not deny them, but I think that if we, instead of going for scale, if we go really for sustained use of toilets, and the NGOs are made accountable for that, and they get a little bonus only after 3 years if their toilets haven't fallen and people are
Sure.
still using, then we'll be doing good. That is a policy recommendation, because there are too many fossils of abandoned toilets.
Thank you so much, Nicholas and Shyama. I am going to suggest that we move on to some questions from our audience, or our participants rather. First, that I would like to invite Nandita Singh to pose your question. If you would like to do that, I will, let's see, I'm going to find you here. I'm going to ask you to unmute. You can just click accept on the question if you would like to pose the question yourself. Are you with us, Nandita?
Yes, yes, thank you. Shyama, it was a very nice presentation. Thank you for that. I thoroughly enjoyed listening to you. Now, I've done some research on sanitation issues in India, and I've come across several villages where the people are very much motivated to have toilets and use the toilets, and therefore, in your terminology, like they have crossed, or they have taken off. But then the slippage has been high and it has been very widespread as well. And the reason was very much hydrological then. And it was not the carrot and stick or rewarding approach was no more important there. But the behavioral reversal, it came up because the people were used to, they were unable to use the toilets after a while, after the monsoon season, for example, because the pits got inundated. And that in turn led to a behavioral change again, after the first time, maybe a second time, because monsoon is not the same every time. So how is there a way that your model can accommodate these kinds of behavioral changes?
So, see, the model subsumed many of the things in the value perception, but you are very right, because throughout the world, international agencies and national governments have opted for the pit latrine because it's the cheapest. And the pit latrine is most unsuitable for coastal regions because it becomes inundated during the rainy season. And even without the rainy season, you see, it becomes inundated so that it contaminates the soil and the water. So much so that there is now...
Shyama, sorry,
Yeah.
for those of us who don't know what type of toilet that is, could you just briefly explain
pit
it?
latrine. A pit latrine. How many of you have seen Slumdog Millionaire? A pit latrine is what it says. It's a pit.
Okay.
It's a pit, and you're supposed to do your stuff. And you see, on top of that, you see, the world is divided between washers and wipers. Okay. And the washers is more liquid. And so the soil is supposed to leach the fecal sludge. Okay.
Thank you.
And then they call it a septic tank if the pit is very large. But a septic tank is not a large pit. A septic tank is something which filters the sludge. So the thing is, the rich people get septic tanks, which means larger pits, by paying the government guys to a bit more to dig the bigger pit. And then it doesn't get used. So I am fighting against pit latrine everywhere, and I want Nandita to give me the names of the villagers, because I don't have Indian names. Okay, I don't have data, because even the government people are not willing to use this, are not willing to accept this. So we activists, because I'm an academic and I'm also a practitioner, we fought to get the ecological toilet. Now I do not want to get into the gory details, but there are simple technology models called the urine diverting dry toilet. Basically, if urine is separated from feces, there is absolutely no problem. But in India, as we are washers, this requires another kind of toilet slab. And so, you see, I got into trouble again, my NGO, because they said that I was making poor man's toilets for them. So the biggest help came in the form of a Swedish visitor. He is a guy who is making these ecological toilets and running his life in Sweden. He is using them for these rock festivals. So he came to the village. I don't know how he found me. And then he was saying how it is being used in the West. Then, my toilet got a much higher status symbol because it was being used in Sweden. So basically, there are simple technology designs, but we need innovation in these designs to make them user-friendly. Again, for that, I need Nicholas, I need Coca-Cola, because I need some money. I need some money to try out, because I can make a toilet. I know exactly what people, and you see, Bill Gates, do you know how much money he has spent? Please, somebody guess in the audience, how much money he has spent on a low-cost toilet? $230 million. Okay. I have seen many of the Bill Gates winners. They have asked me what I think of it. Okay. But there is not a single slum anywhere in the world with Bill Gates low-cost toilets, nor a village. So you see, we don't need Bill Gates. What we need are the local masons, the local academics. I have not got a single good academic institute to work with me on technology design. Why? They all prefer to do AI. They want to be behind a computer. So think about a toilet. So you see, there is a lot of stigma attached because it is a non-glam subject. I'm one of the few who has even dared to write about it in this fashion. So you see, Nandita, I look forward to your data. I need it.
Okay, well, please, take that invitation seriously. Nandita, I see your hand raised. Did you want to respond to that?
Then there is Nelson who has had his hand for some
Yes,
time.
we also have some questions in the chat. So, Nandita, if you would like to respond just to that, welcome to do so. Otherwise, I wanted to share an observation from the chat before inviting the next question to be posed.
Yes, Shyama, thank you for your response to it. I'm really happy that you had someone from Sweden, because that's where I'm based. But a lot of my research has been ongoing for several years in India. And in that context, yes, the data that I'm referring to is from the state of Bihar, where the water table is really high. And it's inland, it's not coastal area. And it is a common problem in many of these high water table areas. It's a very common problem. And the spit latrine is the most common solution even adopted by the government in the recent years.
All over the world.
Yeah, all over the world. And the twin pit latrine system, perhaps you already know, it's the innovation of Sulabh International. So despite the twin pit latrine system, which actually takes away many of the limitations of the single pit one, which gets filled with, because Indians are washers and we use a lot of water. So that limitation is taken away with the twin pit. But what about these hydrological problems in these areas and how to get over this and flooding? I mean, I think it's a big challenge, and maybe you will be able to
that is why the EcoSan toilet, which was again introduced from the Scandinavian countries
Yes.
by a British engineer, that is the
Mm.
only solution. But Nandita, really, if you can send me data, that would be
Yes, sure.
awesome.
Sure.
I
Yeah.
suggest that Nandita and Shama, it sounds like you have more to discuss. Please do
Sure.
so.
Yes, sure.
And
Thank you
since
so
time
much.
is ticking, I'll ask you to have that conversation outside of this meeting. And instead, I wanted to share a quick observation from the chat before going into another question. So just Sarika Saluja here wrote, toilets crumble not only because of quality of toilets, but because of the quality of the material used for
Yes,
cleaning the
yes.
toilets as well. So it's an important part to consider. Now, my colleagues have been feeding me some questions, and we also have some hands raised. So first, I would like to kind of get back into the behavioral side of things. We have a question from Maximilian Bruder and also from Lambert Lamisi Conlan. I'm going to take the liberty of baking those together a little bit. So one is the role that elders have in a village or other types of role models. Could the behavior of these higher weight people in communities, could they update their beliefs, and can these kind of changes be included in the model? And then we also had a question from Lamberta Misi Conlan, who is asking about if there are some community, or stating there are communities that are aware of all the benefits of not defecating in the open, and even so, they're not changing their behavior. What could be wrong, or what could be done related to this? Shama.
Very quick answers. First, in my experience, what I have found is that the age group of 35 to 50 are the most powerful, not the elders. If you can get a young, actually well-earning person to take this and increase his wealth, which we have done, it's the best brand ambassador. Second, for not going, you see, it is a question of design, because as I told you, many men and women have told me why they prefer open defecation, including women. And two things that I have written about, but which I will mention very briefly, is maybe don't put the roof. You see, because people want to feel the breeze and the sunlight and all that. And the second thing, the adolescent girls told me that in villages there is no gendered spaces. So now with everybody, they will put an SMS, time to chat about a guy, and they will all tell their moms, oh, gotta go. And then they go and meet up and chat. So I find that actually the socialization benefits of group open defecation, which is a norm, okay? If this can be replaced by a youth club, gendered youth club, where they can also just come and chat, it would be great. So it's all context specific, but there are solutions. But for that, you have to understand why it is not happening in the first place and be very honest about it.
And are there any aspects that you could somehow bake into your model, do you think?
This kind of a model is not made for that, okay? Because already it is quite complex, when you do it by hand. That is why that value perception is all encompassing. And as Nicholas pointed out, you see, we can add even a fourth dimension. It should be economic benefits, health benefits, environmental benefits, and social benefits. That was the no toilet, no bride thing. But you see, one of the guys was saying, look, the good thing about a toilet is that you can smoke pot in it, and then you can put an incense so that your mom doesn't find out. This is the message he was giving to the other youth. So you see, all kinds of things are there, but you need to find some way to make it
A reflection from my part of the world is that when you have small children, toilet time is also alone time. People my generation here with small kids are joking about that at home, the only alone time you get is when you go to the bathroom. So the bathroom has many, many things to offer. Now, next, I would like to invite my colleague Nelson Ikana to ask your question or also contribute with any reflections you may have. Nelson, you've been working in the field of WASH and specifically CLTS for quite a while. So over to you, Nelson.
Kali, and excellent presentation, Shyama. I enjoyed actually listening to you outline that model and the cross-examining of Nicholas. I think you actually were on point with some of the concerns that we face. I think the specificities of the different approaches that are used, CLTS is one of many, and you know, this aspect of context and culture, which you highlighted, Shyama, is important. Now, the question now that I would ask is related to context. The same as CLTS was actually piloted in Bangladesh and India, and then, of course, rolled out in Africa. Would that be also the same for your model? Because I think specific aspects of culture would need to be taken into consideration, because there are some big differences between India and most of the Africa. Even within Africa, there's a lot of differences. Nigeria and Ghana, for example, and Nigeria and Cameroon, Kenya. So that's one. Another thing is if we highlight, you know, those people that are defecating in the open, we find that majority of them are living below $1 a day, and predominantly the rural areas. So that takes us to the issue of poverty, and was raised in the chat as I saw earlier. We're trying to get access to people who can afford, and that would bring us to the complexities of development itself in that context. And why are we struggling with these basic needs? You know, what are the social, economic, and political pressures that are acting on people? And why haven't we been able to address these challenges? You know, and I think your model perhaps may not be able to encapsulate all these, but I think your reflection will be good to have in terms of, you know, the planning culture, for example, in India, the historic past, and also Nigeria, so Kenya, and how that has evolved into what we have today in the Africa city, and, you know, the peripheries, you know, peri-urban areas and the rural areas that are, you know, actually the have-nots, and the city center core has. So just your reflection, I think, Nicholas, yours as well would be good to have on this point.
Sure.
The first thing is rural and urban dynamics are very different. The problem is different. The solution designs are different. Okay. So what I have said today pertains more to rural areas. But Nelson, you have pointed out very clearly, you see, the NGOs in applying the CLTS method. See, it is almost, they're going by the book. And you cannot go by the book. You need time, but NGOs are under contractual pressure. So I would say the main pressure, the bottom line is always money. So, you know, to make a good toilet now, especially an ecological toilet for these coastal areas, it's pretty costly. For now in India, it's costing me to make one toilet almost 1,000 euros to make a proper one. Okay. That will withstand cyclones, that will be, so the government is giving about 150 euros to make toilets. Okay. Now, if an NGO wants to make a business model, they have to take these 150 euros and add a little bit for supervision. And now you cannot build good quality toilets with this kind of money. So what I want to say is, the basics is that you got to, in a poverty situation, I've asked this to the minister even before about the pit littering, about 15 years back. How he explained it is as follows. He was before Modi came. So this was a very nice man, but he said, Shyama, we are all aware of the technology design problems. but we want behavioral change. Then we will see what can be done. And then you see, that was, I feel, a wrong thing, because it has led to all kinds of problems, because people have moved away from toilets when they saw that having toilets is actually causing more diarrhea because of pit latrine. So to resume, it is a main problem with CLTS is that NGOs are also under pressure. I am an academic. See, I'm doing it as a charity. That's why I asked Carly to say Friend in Need Trust as a charity. So I am taking time. I'm not making more than 4 or 5 toilets per year, because it takes me a lot of effort to even raise 5,000 euros. And the next government, you see, in the next village, people want more and more. I've created a demand, but they want me to build each toilet for 300 euros in 2 months. Now, come on, how can I do this? And when I go to the people whom they have assigned, they don't even know about EcoSan. So oh God, I'm now going too much into detail. So CLTS, they have to, NGOs need time. This is not something you can do like this. So you need to sit and understand the local culture. So enough time has to be made for this winning the people's trust. And people don't come to meetings in villages just like that. They're missing their favorite TV program, or they are missing out. So you have to offer them goodies. You have to offer them tea and snacks and some entertainment. And all this costs money. And which government is paying for this kind of things to win the people's trust? So I must say the NGOs are doing the best they can, except for the ones that cheat. I'm not taking those. The good NGOs, let's say, they're doing a good job. They're doing a good job, but they cannot do otherwise, because it takes time to understand. It takes time to build a good toilet, and it costs money. So community toilets is a solution told by Nicholas. Very true. But community toilets, then nobody wants to work to maintain a community toilet. Only the migrants or the lowest of the low in the social class do it. Nobody wants to maintain a toilet. So this is creating, unless you change the perceptions in the people's mind that cleaning a toilet is just like mowing an agricultural field, or punching something on a computer. You got to do something. So you got to change the attitudes. I don't know how that's going to happen. So I'll just say, I don't know what to do. So, but all these problems are true. I go to Nicholas.
Thank you, Shyama. And I'm just
Okay.
Nicholas, before you go ahead, we're going to wrap up in 1 minute. So please keep it as brief as you can. And then I'm going to say a final closing remark before. Thank you.
Just to add, unfortunately, we don't have time anymore. That was why I said I'm going to have another session on this. But I think on the community toilet in particular, since you ended your reaction there, it's something that is owned by individuals. So individual put up a toilet because the person feels that the toilet, so people have to pay before they use the facility. So the person also employs people as well. That is part of the job creation in that value chain, where people will also be working there, maintaining the toilet. So the quality of the toilet will make it easy, just like my colleague as well, Sarika, from the World Toilet Organization also mentioned the quality of what you use in cleaning the toilet. If you know that you own this toilet and you want to maintain it, and you are taking money, people are paying small amount of money to use the toilet, so that you'll be able to also get some money for the for the maintenance. I think it's something that will also go a long way. But most importantly is the multi-stakeholders, the wash committee in each community will need to be strengthened. They need to be retrained and retrained and retrained with all the challenges. As they're having the challenges, they have to be retrained by different people, and so on and so forth. So it's not something that they just go in there with the triggering process and they pull out. They must have people that will be coming in there. We must have a very robust structure from top to bottom, or bottom to top approach as well, whereby people can also complain about one or two things. People will come back, and that is also the job of the rural government, or the community, or the local government as well. They also have very serious role to play in that regard. Thank you so much, everyone. I will hand over to Kali now. Yeah.
Thank you so much for those finishing remarks, Nicholas. So we still have a lot of questions in the chat. We have a hand that's been raised, but we didn't have time to invite everyone to pose their questions. We do, however, have to end. I will keep the meeting alive and going for a few minutes so that, for example, you guys can take note of Shyama's email address if you had more questions to her. And also I would bet that Nicholas would be happy to share his email address as well. I do want to say huge thank you, Nicholas and Shyama, for joining us today. It was a very interesting discussion. I think we all learned a lot. When it comes to the dialogues on development research, we will have our next session in September 26th, with a very different focus. We will be talking about I'm losing the name, but it's a book called Mission Driven Bureaucrats, and the author is Dan Honig, and we look forward to that session as well. Welcome to join us then, and thank you everybody for being here today.